Hello, everyone. This is Dr. Hope Watts, board certified family physician, speaker, health coach, and lifestyle manager. Hope you're enjoying this time of celebration for the 4th of July. I'm quite sure that you're glad it's happening because I know a lot of people are tired of being cooped up in their individual homes. So today we thought that we would just talk about the ways you can be safe in the 4th of July celebrations and meeting with people and just having a nice time, but being safe. First, I would like to talk about the symptoms of COVID-19, just to review. Some people have a fever, and usually this is higher than any fever they've had before or they can think of in recent memory. Also, they may have a sore throat. They can be very fatigued. You just can barely scrape yourself up out of the bed. Some people also have a change in their sensation of taste and smell. They can have chills, and they can just really feel sick, just very sick. If you have any, the other thing I must mention is feeling short of breath. You just feel like you just can't catch your breath at times. If these symptoms have happened to you, you need to self-quarantine yourself in your house, contact your doctor, and request testing for COVID-19. Take the necessary medications such as Advil or Tylenol to help with the fever and the muscle aches and pains. Now, there are other symptoms of COVID-19 that need to be directly addressed by someone in the emergency room. These symptoms are more severe than the ones that I have just discussed. And one of them is having a bluish tint around your lips, or your face seems to be turning purplish blue. Having chest pressure or chest pain that is unrelenting. Feeling confused. You're supposed to be going to the bathroom, but you found yourself in another room in the house. Not being able to make sense of things. Having severe shortness of breath. You are just having difficulty even getting up because you're so short of breath. Inability to stay awake, or you're awake and you just keep falling asleep. For these matters and these symptoms, you need to contact 911. The medics can make a determination because they are going to probably ask for other health issues that you may have, and they'll make an assessment in conjunction with someone in the emergency room to see if you really need to come in. More than likely, these symptoms are so severe that you probably would need to come into the emergency room. Also, there are people that are at high risk for COVID-19 based on their medical problems. These problems include high blood pressure, being a smoker, diabetes, type 1 or type 2, having heart problems, or your doctor says you have heart disease, or maybe you've had a heart attack before. Also, having a transplant in the past, or you may have had treatments for cancer in the recent past. Also, asthma or COPD. COPD is the correct terminology is chronic obstructive pulmonary disease. Some people call that emphysema. These and several other health conditions put you at high risk for getting COVID-19. This is but a small list, and if you feel you need to have a more extensive list, just go to cdc.gov/COVID-19. Additionally, there are people who are at high risk for COVID-19 based on their age. If you're in the 60 to 70 age group, you are at high risk just because of the age group. And we have found that there are many people who have caught COVID-19 and they have a very severe course of the illness, and some of them have passed away. Additionally, people in these age groups do have some of the underlying health conditions that we just spoke about. And that could be high blood pressure, diabetes, heart disease, and it could be a mixture of many different health issues. So in addition to the age, patients sometimes have multiple health issues that make them more at risk for the COVID-19 virus. So let's talk about how to decrease your risk for COVID-19. And I'm quite sure you've heard about using face masks. You can wear the disposable face masks or the reusable face masks. The reusable face masks are usually cotton, and they have a cotton lining in them. And they do an excellent job, or a very good job, of decreasing people transmitting the virus to others. And don't forget, the reason why we are asking people to wear face masks is to prevent the spread. And if you are one of those persons who has COVID-19 and have no symptoms at all, that will help decrease the spread. And so we're asking everyone, regardless to what you've heard or regardless to what you've seen by other officials, please wear a face mask. The CDC is recommending it, and many jurisdictions have mandated face masks. I know in some states, they are actually having monitors who are going to monitor who has one and who doesn't have one. Now, the surgical face masks that you've seen, the blue ones with the little white piping around it, they are also still a very good way to help prevent the spread of COVID-19. Additionally, the CDC has also recommended that people can wear cloth face coverings. Initially, they were saying bandanas, and I've noticed there's some newer face coverings that look like a ski mask, but they don't have any eyes in them at all. Whatever you do it for you, your family, and for everyone else in society. So let me talk about the correct way to wear a face mask. We should be making sure that the mask covers our nose completely. On the surgical face mask, and even on some of the cloth face masks, there is a wiring at the top where you're supposed to put it on your nose. Squeeze that as much as possible so that you have a firm fit around your nose. The rest of the face mask should be covering your mouth completely and really should go under your chin. That is the correct way to wear a face mask. Oftentimes, I'm in the store and I see people who work there, or even other customers, who have the mask on and is only covering their mouth. That is the incorrect way to use the face mask. So please be diligent in using the face mask correctly. Additionally, social distancing is very important. we have adopted the 6 feet apart social distancing leverage. Other places don't recommend them at all. In some countries, they have decreased the social distancing yardstick. This is important because the closer you are to people, the more likely things will be transmitted. And you often want to be 6 feet apart, whether you are in the store, whether even you're walking outside. There are times when I'm walking outside and I see someone coming on the same pathway, so I elect to move out into the street or vice versa. So the other thing is hand washing. And many people are tired, just like I am, of washing my hands all the time. But that's one of the best ways to get rid of the virus on the surface of your hands. You're supposed to wash your hands for minimum 20 seconds. Now you can count the 20 seconds. I've also heard that the happy birthday song is exactly 20 seconds. So if you want to sing the happy birthday song, whatever makes you feel better. And you are welcome to do that as long as you are getting your hands washed. Also, you should use a soap that lathers. You can use bar soap or you can use liquid soap that lathers. My hands have started to get very, very dry from all the hand washing. And a lot of times I have to put lotion on there because your hands can get very dry from doing a lot of hand washing. So let's move on to how to be safe during the 4th of July celebration. You haven't seen people in a long, long time, and you're really anxious to see Aunt Sue or Uncle Joe, but we do not recommend hugs or handshakes. And I was surprised to learn that you couldn't do elbow bumps, because I've been doing that, thinking that I was doing something correctly. So I'll have to stop doing that. So a nod would be fine, just to acknowledge them. So you're not doing some of these other activities. Also, we recommend that you do activities outside. Now, it is summertime, and I live in Charlotte, and it's almost reaching like 90 degrees. So maybe spend part of your time outside and the rest of the time inside, but remember to be socially distancing. Try to make sure that, a lot of times everybody can't sit at the table because of social distancing. So they may have to sit in various different areas of the house. Also, plan activities so that everyone's not in the same room at the same time. And be creative. Find, various activity centers in your house for different people to do. The last that I heard, I think that the size of the gatherings in North Carolina were 10 people. So 10 people, easily you should be able to, work with that number. I know in some states, the gathering size is 50. That's going to be hard to negotiate in a house situation. Also, we want to talk about traveling. Traveling by plane is fraught with difficulty. Don't forget that just getting to the airport, there are usually crowds there. A lot of times you'll have to check in. So they have kiosks all over the areas near the airlines, and there will be crowds there also. Then you have to line up. If you have baggage to check, you have to wait for the person to put your bag on the conveyor belt. So leaving that area, you have to go to TSA, and that is usually a very crowded area. They may have markings on the floor, but if it gets packed at the end of those markings or decals, there's still going to be a lot of crowding. And let's not forget that when you get to your gate, there's going to be crowding there because everybody wants to get on the plane. So there are lots of crowds, and even if you have a mask on, there is no guarantee that you can avoid being exposed to COVID-19. Also, some may have the N95 masks, and they are good. They're used by the first responders and the majority of people in the hospital. But I want to alert you to the fact that some of the airlines have chosen not to practice social distancing on the planes. Initially, they said we would do every other seat. And one of the major airlines, I am not going to mention the name, has decided not to do that. So there are risks in going to the airport, waiting in line, and being on the plane. So we would very, very severely recommend that you avoid planes at all costs at this time. Additionally, trains and buses offer no advantage at all. You're going to be in a place that is probably have a lot of people there, and you're not going to be able to see everyone. So you're not going to be able to see who was wearing a mask. And usually on the buses, there's no one monitoring that. And on the trains, most of the people some of the officials walk, they're just getting the officials that walk in and out are getting your tickets, and that's about it. So you're going to be in an area same area for a long period of time, and you're putting yourself at risk. So we'd recommend that you avoid that. The best alternative is using your car. And usually it's someone that you're going to take in the car with you. And if you've traveled this way before, you know where the stops are to get food and what have you. And some of them have apps, and you can order your food and just do curbside pickup. Also, restaurants. Everybody may be tired of eating food at home, and the restaurants are another option. We recommend getting like DoorDash or Uber Eats. They can deliver it to your home. Also, many of the restaurants have curbside delivery. So you can order your food, pay it online, and then a lot of times, because I've done this myself, you just call them and say, hey, this is my name, and you may have an order number, and they can just bring your order out to you. So some restaurants are a little bit more creative, and they offer outdoor eating. Now that's better than being inside, but you still, the last place that I saw did not have a lot of space between the tables and the chairs. So you have to be very leery of that. Also, we do not recommend stadiums. There's been a lot of controversy about large mass gatherings in stadiums. And there's been a lot of talk back and forth about how these gatherings are contributing to the spike in COVID-19. We do not recommend them because you're coming into a crowd, you don't know who the people are, and from what I saw in these large rallies, none of them had a face mask on. So there are mixed messages being given to us from our political leaders and what the CDC is giving us. So we want you to enjoy your holiday. We want you to have fun, but we want you to be safe. And we also want you not to catch COVID-19. So remember, the larger the gatherings, the more the risk you will entail as a result of the COVID-19 virus. Thank you. Have a happy July 4th.